San Diego has fully reopened. A look at life beyond COVID restrictions. From the impact on businesses to the new face of the workplace. See the triumphs and breakthroughs on the road back to normal. The Rebound San Diego, all week on ABC 10 News.
Guys, thanks so much for joining us for this edition of Ask the Expert. We are joined by Dr. Abisola Olalade, who is a family medicine expert with Sharp Reed Staley. We like to call her Dr. Abby. And she's going to answer some questions that I think a lot of parents out there are asking as we reopen, questions centered on children with the vaccine, school, and all those other things. So thanks, first of all, for joining us, Dr. Abby.
It's good to see you. Thanks for having me, Virginia.
Great to see you. So let's start with a basic question. I mean, as you know, some unvaccinated kids already started doing in-person learning this last little bit in the last month or so, but a lot of that was hybrid. Can parents feel safe about sending their unvaccinated kids back to school this fall for full-time in-person learning?
They can absolutely feel safe doing this. And I do think that it's important that we work toward getting children back into class full-time for their learning and their education, because it's so important. We know that a lot of children had difficulty with adjusting to this hybrid model, or even all the challenges with having just a virtual model of learning, and they can absolutely feel safe. It doesn't mean that the coronavirus is not a threat to children. I have heard that people say that children are not affected by it, and that is completely false. They are affected by it. There is a risk, but there are ways that we can do it safely.
You know, there may be children who still feel very anxious about this as we move into different phases of opening, as we learn more about the virus and about the vaccines. What do you recommend parents do in terms of talking to children about vaccines, about COVID, about going back to school, if those children are feeling a little bit anxious?
Well, the first thing is that we should always listen. That's always the first step. You want to make sure that you listen to your children. And you also want to make sure that you are paying attention to their behaviors. Children are not necessarily going to come out and tell you that they are feeling anxious. A lot of times there are subtle changes in their behaviors, and it may be regressing in very young children to previous behaviors. It may be that they are quote unquote acting out. It may be that they're more quiet. Always pay attention to that. Even their eating patterns, their sleeping patterns, those are all important things. And make sure that you normalize the fact that this is anxiety provoking. It's not a good idea to say, don't worry, don't feel this way. That's never a good idea. You always want to say that it's okay to feel this way, and to basically get them help if they're not dealing well with it, and to make sure that you are also taking care of yourself. The first step is to put on your own oxygen mask. So treating your own anxiety is going to be very important, and making sure that you get them help if you see that they are not coping well.
So as you know, so far, the Pfizer vaccine is the only one with emergency use authorization for that so far youngest authorized group, 12 to 15-year-olds. What are you hearing about the reactions they are having to the vaccine?
So we've had the opportunity to study lots and lots of children, essentially in real world conditions, and the vaccine is safe. This is the reality, and this is the truth of seeing all the people that have gotten vaccinated. And it is great that we have a way to prevent children from getting ill from coronavirus. We have a way to prevent them from getting hospitalized and from dying, which is certainly a possibility. Now, it's important to remember that just because a vaccine has side effects doesn't mean that the vaccine is not safe. We know that it is normal to have an immune reaction, which is essentially what side effects are. And they are actually a good thing. It tells us that the immune system is responding to the vaccine in the way that we want. It is priming the body to be prepared to fight the virus when they come into contact with it. So it is a good thing, and it's a very important thing, because as they go out and start to attend play dates and go back to school, you're basically giving them a suit of armor that will protect them. And parents understandably are very worried about doing the best thing for their children, and this is the best thing to do for your children. It's important to remember that.
Dr. Abby, if a child has already had COVID, should they be vaccinated?
Absolutely, yes. And this is actually a question that comes up all the time. And it's the question of natural immunity, whether that's enough. And right now, we don't know how long the natural immunity lasts. So when someone gets infected with COVID naturally, they do develop antibodies that can be protective. But what we know historically is that those antibodies, in most cases, don't last as long as the antibodies that you get and the protection that you get from getting a vaccine. So essentially, you're going to get a lot more protection when you get vaccinated. And that becomes more important, especially as we start to see these variants that are circulating, and they are more contagious, in many cases, potentially more deadly. It's important to have a stronger suit of armor, and that's essentially what a vaccination is. And so it is recommended that you still get vaccinated even if you have had COVID in the past.
Now, we have heard of some children who get COVID and they're asymptomatic, or maybe they have mild symptoms and they get over it, but then they develop a rare but serious condition known as MIS-C, this inflammatory condition. Is that a reason for parents who may be on the fence to get your kids vaccinated so they don't develop that?
It is absolutely a reason. And essentially, you touched on this very important issue, which is, as you said, a multisystem inflammatory syndrome. And what it is essentially a reaction that the body has to the coronavirus. And it's an immune reaction that really essentially causes the body to start to attack its own organs. Several organs can be affected: the intestines, the heart, the lungs, and it is life-threatening. It is absolutely life-threatening and extremely dangerous. And it is rare, but it is definitely something to consider and to remember when we talk about vaccines. And we know that vaccination does prevent this outcome, and it does prevent this effect. And so it's very important to realize that this is one of the reasons why you must get your children vaccinated in order to protect them from this.
And I'm wondering, for parents who, again, may be on the fence about getting even themselves or their kids vaccinated, some have been saying they want to wait until the FDA gives full approval as opposed to emergency use authorization. What do you say to people who are waiting for that?
I would say that the choice to wait is risky. You're accepting a level of risk that is really it's a dangerous thing to do, because the fact that the FDA has not approved this doesn't mean that the vaccines aren't safe. All the steps that are taken when any other therapeutic is approved were taken here. There were no shortcuts that were taken. These technologies have been around for a very long time and have been studied both in these experimental and trial conditions and now in the real world. And it just takes a long time for FDA approval to happen. FDA authorization has already happened, and there's absolutely no reason to wait when we have a vaccine that can prevent catastrophic outcomes for a coronavirus infection. There's really no difference in terms of what they're going to say with the approval versus the authorization that is significant enough to affect that protection. And so it's important that you not wait for that. And remember that this is not still experimental. It's not still in a trial. The trials have been completed in tens of thousands of people. And we also have seen millions of people all around the world get these vaccines. So there's a consensus in the scientific community from many experts. This is one of the most studied data in the world probably ever, because of all the eyes that were on this. If there was something that was nefarious or quote unquote not right, it would be unusual for that to be missed by several scientists and several doctors all over the world. We also know that there's a study that came out that stated that 96% of practicing physicians have gotten vaccinated against coronavirus, and that should say something. So it's important to remember that.
Dr. Abby, we have a question from a viewer, Cheryl, who asks, I feel anxiety just thinking about going to a ball game or a grocery store. she wants to continue to wear her mask in those situations. And how safe is she doing that?
Cheryl, I would say that if you have been vaccinated, then you can actually feel confident that you are protected. And so that's the important thing. If you've been unvaccinated, if you haven't gotten your vaccine, then yes, there is reason to worry. And if you're someone who's not been vaccinated, then you're actually more at risk now because of these variants that, again, are potentially more deadly. You are more at risk now than you were at the start of the pandemic, because the coronavirus has evolved to become more dangerous and much more of a threat. But if you are vaccinated, there is a lot of evidence to show that the vaccines protect you against the worst outcomes, which is getting hospitalized and dying from this. And so I think you can feel confident, especially if you're outside. So a lot of the baseball games are outside, and there is a low likelihood of getting infected if you've been vaccinated, especially if you're outside. So I think you are okay to take off your mask. However, there are people that feel more comfortable with their masks on, and I think that that's fine. People should be allowed to do that if they feel more comfortable doing that.
Dr. Abby, some people have expressed concerns about potential long-term side effects or consequences, saying that these vaccines haven't been studied enough and haven't been around long enough to know that, 5, 10, who knows, 20 years out. What can you say to those folks, either for themselves as adults, but also for their children?
So we know from studying his vaccines, over decades and decades, that most of the side effects, and really the most serious side effects, are found within the first few months. So it would be very unusual for there to be long-term side effects that we have not seen at this point. That's just not something that is seen, and it's not credible in terms of a theory. So it's important to remember that that's not really a concern. It's not a consideration. Most of the side effects from vaccines, just over years from what we've been able to study, are found in the first few months. And this is the time frame in which the trials were done for that reason. And again, the vaccines have been around for such a long time now that if we were going to see those effects, we would have started to see them by now. And so that's the answer to that. It's not a reason to not get the vaccine.
What about households where there are children of multiple ages? So let's say you have some who are vaccinated and others who are not because they're not eligible yet. Should parents take extra precautions in that scenario?
Well, that's a very important question, one that we get all the time as well. And what we're seeing, actually, there's data that has been released that shows that the best way to protect people that can't be vaccinated, to protect children that can't yet be vaccinated, is if the people around them get vaccinated. So children are protected if the adults and the older children around them have been vaccinated, because that reduces the risk of spreading coronavirus to them. And so that would be the most important thing, especially children that we know are at higher risk of getting severe illness from COVID. It is paramount that the people around them be protected. And so that's what I would say to that.
So if, for example, in a situation where if you have an unvaccinated small child who's around adults or grandparents, if those adults are vaccinated, you think that it's fine to gather indoors for a child who is unvaccinated?
Absolutely. It is. It absolutely is fine. And that is actually the recommendation from the CDC for that reason. And it's because we know that the vaccines not only are protective against someone getting hospitalized or dying, they're also actually protective against infection, so spreading the coronavirus. So it's unlikely that someone who's been vaccinated can spread it to someone else. And so, yes, it is okay in that setting if the people around that child have been vaccinated. It's okay for people to gather without masks on in that setting.
Dr. Abby, we hear a lot about herd immunity. We keep talking about getting to a certain threshold of vaccinated people in this county, in the state, in this country, in the world, that can kind of help protect everyone. What does that really mean? So if we were to get to 70 or 80% vaccination for those people who are unvaccinated, does that protect them, or how does that work?
So in terms of herd immunity, I would certainly not rely on that if you're someone who's been unvaccinated, because it really is a bit of an elusive concept. We know that more people than not have to be vaccinated, but putting a number on it specifically is an impossible thing to do. Yes, we know that if more people are vaccinated, then that decreases the chances of coronavirus spreading. But we have to remember that there are variants that are much more contagious. For example, well, it's not really new, but we're learning more about the Delta variant, which was initially found in India. And it is actually, by a lot of estimates, much more contagious than the Alpha variant, which was found in the UK, which in and of itself was 50% more transmissible than the strain that we were dealing with. So this may be the most contagious strain that we've seen, specifically the Delta variant. And so if it's more contagious, that may change the threshold for herd immunity. So you can't expect that you would be protected necessarily because someone else is protected. It's sort of like leaving your garage door open, hoping that your neighbors will protect you from someone coming in and taking everything. It's not a good idea to do that. So I would still make sure that you get vaccinated to protect yourself from these long-term effects from COVID that we know are catastrophic potentially.
We talked earlier about MIS-C as a potential rare consequence for children who contract COVID, young children. We've seen some cases of that, certainly here in San Diego. What about myocarditis? We've reported on some rare cases, not a lot of adolescents and young adults, but some who develop this heart condition after getting their second dose of an mRNA vaccine.
Yes, so it is something that is being watched very closely. The first thing I would say is that myocarditis is actually something that has been seen with other vaccinations. So this is not the first time that we've seen it. So even with the flu vaccine, for example, there have been reports of myocarditis and other types of vaccines. So it's not something that is new. We don't know yet if there is an association with this. The CDC is going to be meeting tomorrow and giving some information about that. But it's important to remember, again, when it comes to the side effects of the vaccines versus the side effects of COVID we know causes myocarditis and causes it to a greater extent by every estimate that we have, and can also cause more long-term effects. So it's about weighing those risks versus the minimal risks of myocarditis, which are really minimal. In terms of what we know now, we know that even if it is related to the vaccine, it is a very, very small likelihood that a child is going to get it. And it does tend to be self-limited. Most children, the overwhelming majority, do get better and recover from this if they do get it associated with the vaccine, and they still get that protection. Understandably, that's not a lot of comfort to parents because they don't want their child to be the statistic, even if it is rare. And I do understand that, but you have to remember that the risk of COVID is far, far greater than this minimal potential risk of myocarditis.
And if someone were to develop that, do they recover? Do young people recover pretty well from it afterwards?
Absolutely. They do recover from it. It is self-limited and they get better. The overwhelming majority of children do get better from it if it is something that develops, and they still have that protection from getting COVID, which can have far more worse consequences.
And now you touched on this when we talked about potential long-term effects. I want to address something specific because it has come up over and over again despite doctors addressing it, and that has to do with fertility. Not just in adult women of childbearing age, but also children, girls, let's say, who, one day may want to have kids. Is there any concern that this could affect their fertility going forward?
No, there isn't. There's just no evidence of this. This is an unfortunate urban legend that has really taken hold and spread. And I think the way to understand people's feelings about this is to understand that is to acknowledge that they are real. That for a lot of people is a devastating consequence, and I do understand that, and it's important to acknowledge that. But there's also just no evidence that the vaccines cause any changes or any issues in fertility. There's also no biological basis for that. And so I think it's important to really be careful with misinformation that is out there, and make sure that you are going to sources that are reputable, that are trusted, that are people that actually do study this, that are experts in the field. And there is just no evidence that these vaccines cause any changes in fertility, both in young people and in adults. In fact, we know that during the trials that were done with the vaccine trials, there were women actually that got pregnant during the trials. And so that is really evidence of the fact that this is just not something that is true at all. And so you should definitely protect yourself, and it's not a reason to not get the vaccine.
And you hit on the other situation that we received lots of questions about, and that is pregnancy and whether the vaccine is safe for women who are actively pregnant now to take.
Yes, from all the studies that we know that it is safe. And it's actually important to remember that pregnancy is one of the conditions that can put someone at risk of getting severe illness from coronavirus. So pregnant women are susceptible to the effects of COVID more so than the average person, and they really can get worse outcomes, and it can put them at risk of actually having miscarriages. So it is important to remember that getting the vaccine does protect you from those harmful effects, and the American College of Obstetrics and Gynecology has put out a statement saying that pregnant women should be allowed access to the vaccine because it is protective. There's also studies that show that pregnant women make antibodies that protect their children, their unborn baby, from the effects of coronavirus. And so that's important. We definitely still do recommend it for pregnant women.
Now, as we know, the vaccines that were approved, especially early on for adults, they never said they're 100% effective. I mean, they're mostly in the 90% range, some of them down in the 80s, depending on which one you're talking about. And we hear cases of breakthrough infection. Can you explain to people what that is and whether they need to be concerned about moving through society normally without a mask, even if they're fully vaccinated, knowing that this is a possibility, though slim?
Yes. So the first thing to remember is that there's no vaccine that has been developed that is 100% protective. That would be wonderful, but there's just no vaccine that can do that. But the vaccines are really good, as you said, at protecting against those outcomes of getting hospitalized and dying. And that's what is important to remember, is that when we see breakthrough infections, when people get infected after getting their vaccines, we do see that they have a milder course of illness. They don't do as badly as someone who has just not been vaccinated. So it does protect you from, even if you do get infected, it does protect you from getting a severe illness. It may just be mild and then you're better. And so that is the thing to remember. It doesn't mean that the vaccines are not effective, and it doesn't mean that they're just mildly better than nothing. No, it's not better than nothing. It's important to get them for that reason. And then sometimes what we also see is that when people have not been fully vaccinated, then they kind of go out and about and they let their guard down. So remember that you're not fully protected until 2 weeks after your first dose of the J&J vaccine or after the second dose of the mRNA vaccine. So it's important to remember that it does take some time to build up that protection.
So for people who are fully vaccinated, you feel that it's perfectly safe and you should expect to be able to move around and follow the current guidelines, which is if you're fully vaccinated, you can be outside without a mask, you can be inside around other fully vaccinated people without a mask and not have to be worried or nervous about it.
Yeah, absolutely. Absolutely. That is what all the evidence and that's what all the data is telling us. However, certainly that may change, again, especially because we don't know how long the protections from the vaccines last. We don't know what the dynamics will be once we get into the fall and people start to go inside and gather. And we also know that a lot of people are not getting vaccinated. So the people that are unvaccinated, unfortunately, put everyone else at risk, because it gives the virus a chance to learn how to become better and learn how to become more dangerous. So we may see more variants that are dangerous, and we may see cases start to go up. We're also seeing people that are traveling. And so, of course, that always, will lead to spread. But it's important to remember that the best thing you can do to protect yourself is to get vaccinated. And at this point, because cases are staying low, then yes, you can go out and about and you can gather and interact with friends. There's nothing that's 100% zero risk. It doesn't mean that the risk just goes to zero completely, but you can feel safe to resume life almost as what we were doing before the pandemic started. And so that is a good thing.
And you just touched on vaccine immunity. What is the latest guidance on whether people will need booster shots, how soon that may be required? A lot of people getting vaccinated just in the springtime here, the last few months. Are they going to need a booster shot in the fall? Will they need another shot in a year? How is that going to work?
We don't know that at this point. Unfortunately, predicting that would be looking into a crystal ball. I wish we had the answer to it. What we do see, though, is that the immunity and the protection from vaccines is holding up. And we see that people still have very good protection this far out. And so that is a good thing. We certainly may need boosters. It's hard to say. It should be determined by public health officials that are studying this, of course, and not the vaccine manufacturers. A lot of the announcements have come from, of course, the vaccine manufacturers. It's a good thing that they are looking into this and they are studying the effects of getting additional doses, but we may not need it. We don't know that quite yet, but I think that the focus should be right now. It's hard to predict the future. You can prepare for the now, which is by making sure that you get vaccinated if you haven't gotten one yet. And I think it is a good thing that we are starting to shift toward giving the vaccines, for example, in doctors' offices and in pharmacies, because then the infrastructure will be there if we do have to give these boosters, and hopefully more people will have access to them.
Dr. Abby, so paint the picture for me. So in the fall, a lot of school systems, including San Diego Unified, going back to in-person 5 days a week. If you're fully vaccinated, again, following the guidance, it's okay to be inside with other people. Presumably, there will be a percentage of students who've not been vaccinated. How is that going to work in terms of keeping everyone safe? And are you concerned about the concept that there could be a stigma, or, when you start to separate out children based on their vaccination status, and try to go through a school day and deal with that?
Well, and this is just in general, there really should not be a stigma around being vaccinated or unvaccinated. And I think that is a very good point, not just in children, but in adults. We don't want to, pit some people against other people. We need to get through this as a community and get through it together. And really it's certainly one of the worst things you can do, because we don't want to alienate people. We want to keep the dialogue going in terms of people that have been unvaccinated. But we do know that children are less at risk of getting severe illness from coronavirus, and that is a good thing. It doesn't mean that they're not at risk, but they are less likely to get severely ill or hospitalized. And so if you have people around them, the teachers that have been vaccinated, if their parents have been vaccinated, if older children and adolescents have been vaccinated, then that really makes them so much safer. It really makes them so much safer. Certainly, it would still be important for them to continue to wear masks. I know that is a very difficult thing for people to accept and to realize, but if children have not been vaccinated, the guidance that we have right now is that they still need to wear masks to protect themselves and to protect other children that are even more vulnerable and may be more susceptible to getting severely ill. But I think it is going to be safe at that point, so long as cases are not rising at that time. So it's important for all of us who who are able to get vaccinated to keep them safe. Remember that you're keeping other people that can't be vaccinated, including children, safe when you get your vaccine.
As you know, there is a lack of continuity from one business to another, for example, one state to another, in terms of vaccinated versus unvaccinated, and whether there should be a way to prove that, whether people have a right to know. What is your best sort of scenario? What would you want to see? You know, some places are going to do a vaccination pass, a vax pass. Other places are saying we're not going to do that. How do you enforce the vaccinated can do this, unvaccinated should wear masks, if you don't know who's vaccinated or unvaccinated?
You know, I think that this is, part of what makes public health challenging, and why I don't envy, people that are in this position, because it is a difficult thing. It's based on the honor system, and I think that it's essentially impossible to enforce that unless you create some sort of passport or proof of vaccination. You can't tell by looking at someone whether or not they have been vaccinated. And so I think it does definitely create a challenge, because I think that there will be people that, will not get vaccinated and may not wear their mask. And so unfortunately, I think that is going to be a big issue, and one that we have to try to come together to figure out as a society.
In the real world, you see patients every day. What have you been noticing over these last few months as more and more people do get vaccinated?
Really just the fact that cases are staying down, hospitalizations are staying down, deaths, are, flattened and, have decreased for quite a while. And really, I've seen a sense of hope, and people are very happy to tell me. The first thing, they tell me in a lot of cases is that they got their vaccine, and we celebrate together. And it really is that life has started to go back to somewhat of a normal level, and we are seeing that things that we took for granted before, which from a healthcare standpoint, being able to just have office visits safely is so important, because there are many things that need to be taken care of, preventative screenings and all of these things that we know keep people healthy. That has been something that we are grateful to have as healthcare providers, to be able to see our patients face to face, and then just gathering with family, being able to visit family, being able to exercise, and at the gym. These are all things that I think a lot of us took for granted, and that we are all grateful to have. And even just looking around and seeing our loved ones who have come through this and have survived. But I'm also seeing that there's a lot of anxiety. There's a lot of post-trauma from this, which is something that we are going to have to reckon with and deal with as a society. And, it's important to remember that life can go back to normal. It's going to be hard, and it may be difficult to kind of resume these things, and it may feel awkward at first, but we can move forward toward this together.
And seeing the hope out there and people just smiling again, because a lot of them are taking their masks off, is a great thing. And I don't want to be a Debbie Downer, but officially the pandemic is still here. It hasn't ended. Do you have any concerns going forward that at any point we could relapse, or do you feel like we are starting to get out of the woods?
We can absolutely relapse. That is always a concern. And, if this virus has taught us anything, it's that it doesn't behave in the ways that we expect it to. That is always a risk, and it's always a concern. And so we want to make sure that we are prepared for that. We're prepared for that possibility, and prepared to do what it takes to try to limit a surge by following all the guidelines that have been put in place, and also by getting vaccinated. But yes, there is a potential. The pandemic is not over. Just because the virus is invisible doesn't mean that it is not here. And not only is it still here, it's actually gotten worse. It's gotten far more dangerous, far more contagious, and seems to be efficiently evolving in a way that could become a threat at any time. And so that's why it's very important that everyone get vaccinated, and that we continue to look to the guidelines and the case counts and prepare for the fact that, yes, things may roll back, but also I think it's okay to enjoy the now and enjoy this present moment.
You've probably heard this, people have been talking about it as kind of a pleasant side effect. Between masking and social distancing, we've seen such a lower number of flu cases and sort of other kinds of contagious viruses, because that's what happens when you stay away from people and you're masked. Would you want to see people continue to mask during flu season to try to keep that at bay, or do you think vaccinations for that will be enough?
Well, it's a very complex question, because we actually don't know with certainty whether or not the flu cases will be prevented by masks. And I think it's something that the CDC will comment on and they will try to address. And so we don't know that. What we do see is actually that, for example, in some cases, RSV, which is a respiratory syncytial virus, which predominantly affects children, has actually gone up in terms of the cases. So we've seen that as children gather again, people are getting together, and as they're traveling, we do see that certain viruses, such as cold viruses, have made a comeback and a resurgence. And we may see that in the fall with the flu, potentially because people were not exposed and may not have immunity, and if people don't get vaccinated. So there's certainly a threat that it may come back. And it certainly may make sense, not just because of flu, but also because of coronavirus. It may make sense to reinstitute masks potentially in the fall. We don't know that yet. Trying to predict what viruses will do, unfortunately, is a risky, very imprecise business. So we don't know. But I do think that the things that we can continue to do, the things that we know work, especially hand washing, which we know does reduce the incidences of cold and flu in children. So it's important to talk to children about that. And it will be important to reinstitute that in the fall and be more mindful of that in the fall, and absolutely get vaccinated against the flu. It will be important to do that this year as well.
Is there anything you want to add, something that you've come across in your practice that we haven't had a chance to touch on?
I think we touched on a lot of the biggest things, but I would say that it's important to remember to try to control the things that you can control and to become comfortable with some amount of uncertainty. We can't predict the future in many ways, but we can focus on what we can do now. So we know that taking care of your chronic health conditions will protect you against COVID, against the worst outcomes from COVID or even from the flu. So we've seen a lot of things like weight gain, people's chronic conditions become uncontrolled because they have been focusing on just getting through this time. So I think it's a good time to start to think about those things, start to exercise, start to work on sleep, start to work on mental health, go in for your preventative screenings, colonoscopies, mammograms, spend time with your family, talk to your family, and, really become closer together, just as a community and as a family, because all of these things we know are protective against coronavirus and flu. And so I think that would be one thing that I would advise everyone to do.
And very quickly, you mentioned mental health. We have seen people just in these first couple of days of reopening who are a little hesitant, a little nervous about taking their masks off, even if they're fully vaccinated, because after this much time of living a certain way, it became our new normal. And it isn't always easy to pivot quickly and try to go back to the way things were. What do you want to say to folks who may be feeling that kind of anxiety?
I would say to just give yourself time. Give yourself time, and if you still want to wear your mask, it is perfectly okay. It is okay to still want to do that. It was a very difficult thing and unfathomable even back then to think that we would all be wearing masks, and then we got used to it. And then now it seems like that we're used to it, it's very difficult to let them go, and that is okay. The first thing is that, yes, we may still need to go back to wearing masks again because of cases going up. So I wouldn't say that you should throw them out quite yet. But if you feel that anxiety, remember that is just human nature. It's just difficult to pivot. It actually causes a stress reaction when you try to go from doing one thing to doing something else suddenly. So it's okay to take your time. This has been a very difficult year and a half that we've all gotten through together. If you still want to wear your mask, it is okay. And as time goes on, you will start to feel more comfortable. And I think that it's totally okay to give yourself time.
Dr. Abisola Ololade, thank you so much. Your family medicine, Sharpie Staley, we really appreciate your expertise. Hopefully you were able to answer a lot of questions out there and and lay people's minds to rest, because there have been nothing but questions really since this started about the virus, about vaccines, about what to do, and the latest guidance. So hopefully we'll be able to continue to get through this together.
It was so good talking to you, Virginia. I really enjoyed talking to you as always. Thank you so much.
Thank you.